Okay, so we're back. This is a dementia care video, and we already know dementia is listed as chronic care. And we already know there are other conditions. We talked about that in the last video that may cause dementia to progress or other conditions that develop because the person simply is forgetting what went on 10 minutes or 20 minutes ago. So these are other chronic conditions to look at for the simple fact that when you're going over these with insurance policies, medical policies, that perhaps you can think about what happens if someone has dementia, Alzheimer's already, and then they forget to take their insulin. Obviously, that's another problem. If they're walking a lot all the time and they forget and it flares up on them, you have another problem. And this is a chronic condition. Why these are chronic conditions? Let me say that. Why is that? Because none of these diseases have a cure, although they have treatments, and also the way the insurance policies list them. And if some people can't afford insurance, they can afford, or they can't afford insurance, they need to look at how to get on to Medicaid. And we're going to go over that too. What are some of the exclusions? So let's go over our caregivers here. You have informal caregivers, and sometimes they need respite care just because it gets so hard. And sometimes these are the only people that can be afforded. This group here, your informal caregivers, okay, these are some of the people who take care of most of the people who are with dementia because, quite frankly, it's very expensive. Community services, including services which provide food, meals on wheels. In a lot of states, this is free. A lot of times, the reason I'm not highlighting this is because siblings of a person with dementia may already have their own health problems and they just simply can't do it. So let's go into a formal setting, assisted living facilities. Most of these you'd have to get into a dementia care center because a lot of these don't provide care if it's just an assisted living facility, and the dementia care center may be on the side. Adult daycare centers are great for those people who like to go. The intergenerational daycare centers with children and senior citizens, you only have a few of those, but they're starting to come on board. Home health care aides, some are not CNA licensed, some are. CNA licensing means that they have training in that field, and they are some of the best. Social workers, if you're on Medicaid, if you want to consult somebody, if the hospital decides to send you out. And then nurses or doctors help diagnose problems, medicines that can help. So if you wanted to get on Medicaid to help stop, here's just some lists. These are lists that happen as of like 2021. Some of this has changed. Like, for instance, used to be your value of your house used to be 300,000, then it got changed to 500,000, and now if you're in Florida, you need to go and look at which one this is and make sure that when you're talking to the Medicaid official, what it is, one automobile per family. Why is this important? This is how they measure your assets to determine if you can get on Medicaid or not. Some people because the person has dementia, they will put the assets in a child or spouse's or another family relative's name and then let that person have it. And then it becomes, are they passive? Is that then passive income? But when you get on Medicaid, supposedly they look through this to see if this is then passive income as opposed to active income, like something you're actually living off of, like your retirement. Okay. And this is what happens. They allow you to exclude one automobile per family. Cash surrender value of life insurance policy is $2,500 or less. You need to go to Medicaid.gov to look this up to see what the values actually are and how this actually works. Okay, what is this look back period? Person has 60 months for has been 60 months what they're doing. This is the way the government ensures that people are not transferring assets to the relatives just specifically to qualify for Medicaid. So 60 months comes out to 5 years, and while the person may need it, they look to see if it was done intentionally or if it was really the way things are. So some people may have to wait a couple of years before they get into Medicaid program, and there are income measurements and guidelines you have to meet to get considered on Medicaid. Okay, original Medicare takes care of Part A, and here's another thing: you have to qualify for Medicare, and they're done on like a quarter system. So, like for instance, it depends on where you worked. Some people used to be private pay, and a lot of times employees were not put in under where you had to pay Medicare for them and so they didn't make the quarters. So somebody told me it was like 14 quarters, and when I say that, I sat for this class for financial licensing, for financial advisor, and for this. But a lot of times things change. So like for instance, if you were on quarters and you had to have a minimum of 14, you had to go at a quarter and you had to do like times 10 years. And so if you were at 10 years and you were full time and your employer was paying for you, then you got original Medicare. And original Medicare is Part A and Part B. Okay, but they don't always do that. So here's what Medicare covers: inpatient care at a skilled nursing facility. Notice what that says: nursing facility, skilled. You can't just go anywhere. It's really most hospice care, but I put some because there might be some things that still get billed to you. And excuse me, and I don't want anybody to come up and say, this is what you told me, this is what happened. Hospitalization, sometimes they have a 3-day minimum. It's a real funny way of billing. Like you may do 3 days in emergency, 3 days in intensive, and then they send you to another part. So they say that you need some more inpatient care to get you better. And it's just really funny how the hospitalization works and how doctors bill services so that Medicare. So again, these are just some common guidelines. Each situation is different and each state is different. Medicare pays copays. Once again, this is some doctors' visits, some copays on them. Durable medical equipment is supposed to be paid for, although I have received, I'm a caregiver, I received bills, like a copay on the durable medical equipment. And I say some prescription drugs because, again, it's supposed to be all prescription drugs, but sometimes you receive even a copay on that depending upon how the doctors distribute it. Okay, and some people do long-term care policies. Let's get here, they have a separate, but you can also do a long-term care policy as a rider on regular insurance, life insurance policy. Please don't misunderstand, it's not health insurance. It's a rider on a life insurance policy. Okay, and it's not on term life. It's on either whole life or a universal variable life insurance policy. And so these are some of the charges. And the purpose of this is to get people used to how much it would cost, because when everyone says expensive and then you read in fine print that you're supposed to have certain costs paid and then it doesn't turn out that way, you have to look at like what's going on. Like this per diem, literally Latin for day, meaning per day, this provides a limit, but the hospital may say, well, you can only stay for 120 days. And your policy will say, yes, but we'll pay up to 180. And then the hospital, and let's be realistic, either needing the bed or needing to cut costs, will say, well, we're dismissing you at 120. So if your policy specifically says that there's this per diem is a cost and you're covered, Okay, and this just explains cost of care is 180, which means the client is this provides a daily limit of 150 assists, and the person will owe 30, and that's 30 per day. So $30 per day could be like another $100. And do you see where I'm going with this? Like costs can get really very costly. If it's 100 days, it's $3,000. It just it it depends. So a lot of people are starting to save, and we're just telling you realistic costs. Uh, Cash basis, the whole amount of care is paid for the day, regardless of the cost. These are things you need to look for. Excuse me. Look for in a policy if you're trying to help a person. Get life insurance, get long-term care insurance, and hopefully you're doing it before they turn 78. Is that age discrimination? No, that's just the time most insurance policies stop insuring, and there's a whole list of reasons for why. You can ask an insurance agent why, you can contact, or you can make deductions, but that's just usually what happens. So for people who are caregivers, for people who are right at that age, like 76, 77, 75, maybe you need to start thinking about some changes this way, so you're not coming completely out of pocket, or so that if something is happening, you're not able to pay, or you may think costs are less than what they are. So this is pretty much just a very cursory thing about dementia care. This is the introduction to healthcare and what ends up happening and how costly it can be. And we thank you for watching, and want you to have a good afternoon.